I have done over 2,000 Journey knees, and I have no qualms in speaking in front of thousands to say that these are the happiest patients I have ever seen in my 20-year career. I look forward to seeing my knees for their post-op visits.
The biggest differences we have seen are the faster recovery with a quicker range of motion. The patients are much more functional.
Journey 2 Total Knee Arthroplasty is the only knee that reproduces normal kinematics. It is really unmatched.
I think that having a previous experience with a physiologic knee is extremely important. No one up until the current time has come very close to a physiologic knee.
It looks like a normal femur. It doesn't look like this big, lumpy, round femur. It looks like the pieces of bone that you take off. So you make cuts in the bone, you put an implant on, it just looks right.
When a company like Smith & Nephew has put so much time into it and has been doing this for a number of years, then they have experience that other companies don't.
The Journey 2 TKA truly addresses the patient's needs and is unmatched in the industry.
So I began to see outcomes in function, range of motion, strength, pain that did not compare to anything I had done in the first 15, 16 years of my practice.
Yeah, the Journey 2 patients are really happy. It's so often for me to go into the office and I do pretty extensive outcome assessments and patient satisfaction measures. And the patients are telling me, and I'm seeing it, that they feel as if the knee is virtually normal.
We've reduced our length of stay in our hospital by 1.5 days, strictly because of this knee and how quickly patients can get up and feel better.
The instrumentation is very precise, yet the implant is very forgiving.
It almost wants to lock into extension. It just goes from flexion and goes boom. And it's really a different feel from a surgeon perspective.
I have Journey patients that are playing tennis. I have patients that have resumed downhill skiing, my own self included. And I think that this type of increased normal natural motion and ability to increase your functional activities are the anecdotal things that you see with almost every Journey patient.
Patients get better quickly. They get their range of motion back quickly. Literally just this afternoon I saw a patient back 2.5 weeks out with almost 120 degrees of flexion already.
Oh, I had an 86-year-old lady who I did, and I see them post-op. They usually get home therapy for 2 weeks, and so she comes in after that with no cane and walking and comfortable with 0 to 120 degree range of motion.
Everybody who has a total knee is going to need some sort of assistive device, whether it's a walker, cane, crutches. They're going to need something in the beginning. But what I see happen is when the Journey 2 knee patients come into my clinic, they are typically able to get away from that assistive device quicker and back to a normal gait cycle.
The patient that I have seen recently with the Journey 2 knee had 115 degrees on the first appointment, and this is in the home setting. And he progressed rapidly all the way till discharge. He could flex his own knee 125 degrees actively without me pushing on him, just bending his knee. And when we pushed on it, it went to 140. And in my 25 years experience of doing this, that's never been seen before.
My Journey 2 knee patients typically have better VMO and quad contractions, which help develop the quad strength in that leg, which is vital to the support and stability needed for a total knee. Looking at flexion, these patients are also able to obtain higher degrees of flexion. I get these patients to 130, 135 degrees of flexion, and I do not see that with other conventional knees.
That typical patient might need to go to outpatient therapy for 3 weeks to 3 months. And the patients I have seen with this knee replacement didn't even have to go to outpatient therapy.
My Journey 2 knee patients are getting back to their normal lives at a quicker pace.
When I was taking therapy, There were some people in therapy with me who had been in there for over 3 months. Couldn't believe the bounds I was making. I was riding the bike for 20 minutes. I was doing things that they couldn't even attempt after that amount of time.
I've been biking, I've been doing the elliptical, I've been walking on the treadmill, walking outdoors, swimming, and my goal is to actually do another triathlon and walk the running portion of the triathlon.
I was playing tennis at a level that was the same or better than I was playing before I had the knee replacement, with no pain.
Basically, after 8 to 10 weeks, I had no pain whatsoever following the surgery. I'm very pleased with what I'm able to do.
I couldn't be happier with what has happened with these knees.
It was almost a joke that one person that I knew had a knee replacement, and they were asking me if I'd ever be able to run as well as him, and I run far better than him. So I would say on average, I'm far better than others have had it.
I know people relatives actually, as well as friends of relatives that have had knee replacements. They have told me, or some have told me, that they've got something artificial in them. They feel it when they're going up and down stairs, which I don't.
I came home from the surgeries each time and did not walk with any device. I walked on my own.